thank you for inviting me to present at this important meeting. I have been asked to talk about ubiquitous digital care pathways and service models in secure and intelligent environments. I am a physician in training. My background is in rheumatological knowledge intensive domain in healthcare, and I have been into health informatics since about 1995, since about the birth of the internet. I like to ask questions. And first, I would like to say something about what makes a healthcare ecosystem, a knowledge economy. Then let's say something about care pathways as a member of the digital knowledge, because we have more knowledge artifacts than digital care pathways. I should say something about reasoning and reasoning services. The next question is about the overall theme of this program, digital solutions everywhere, and now machines that can learn, reason, and predict. How do we design for ubiquitous, lifelong, reasoner agnostic learning? And then I will hone in on digital care pathways. What are the good ones to ask for a research community like yours? And which research and innovation agendas are worth pursuing? As a clinician working in this multidisciplinary environment that is health informatics, I like to talk about the domain, because my stance is that if we don't understand the domains and the problems in the domain, we will not be able to create the solutions that will work in the domain. And what I'm trying to relate to you now is that we have healthcare systems, but we also have an ecosystem around healthcare systems. And me, I come from NTNU, a technical university. I am a teacher and an educator. I work at the educational institution. What we here at medical school deliver to healthcare systems is people with competence and skills. But then you have the research and engineering institutions that could also be, of course, a part of a university, but it could also be private companies. What they deliver is knowledge that is relevant to healthcare, is knowledge, medicines, and technologies and medical devices. A third entity in the health ecosystem are the funding bodies. Without them, we can achieve nothing. And of course, in the health domain, the patient and his next of kin is a very central part. And these systems in the health ecosystem, they interact with each other. So a health ecosystem we can describe as a set of collaborating institutions that have together, that they work with health problems. They have service models. They have outputs like biomedical knowledge, competencies, skills, drugs, tools, and services. A health ecosystem that you are a part of. They have viability and they have vitality. And you don't get a vivid ecosystem without vitality. But the critical thing here is that this vitality hinges on the availability of data that are specific to the problem at hand. And that data about health and health problems is the critical resource at any time. So if we think of in terms of set theory, you have this collection of people that we call cohorts. A cohort could be a set of patients which have the same health problem. Out of that, we get a data set on the very same health problem. This is the key ingredient to develop knowledge about the health problem. And that knowledge is used in three areas. drug development, development of medical devices, and in education and training. And these three ingredients are applied to expose the patient to knowledge-based care. So this is the life cycle of patients' health problems: data, knowledge, and tools to improve the condition of the very same patients. And my advice to you is to think of this as a knowledge economy. And the development of a disease or health condition as a naturally occurring phenomenon that can be exploited for knowledge development and learning purposes. And my stance is that the vitality of this ecosystem that you are a part of hinges on the ability to turn a health problem into a valuable resource. And to understand this like this and have every stakeholder understanding the situation as this is a very important task of those who try to drive the agenda within such an ecosystem. So we have heard a little bit about digital care pathways from the last presenter. I like to think of knowledge in biomedicine as a resource, which we have very good access to, which is as a life cycle, but that which doesn't add value to the patients unless it's applied to realize health outcomes. So it is the use of knowledge that matters in healthcare. And if we look at the use of knowledge in healthcare systems have big problems in applying knowledge. We fare poor at problem knowledge coupling. We have diagnostic delays. We have diagnostic errors. We spend too much resources on finding the diagnosis. We are, in my opinion, hugely ineffective when it comes to planning, coordinating, delivering, and assessing the outcome of knowledge-based care. And we are also not good at letting the patient engage directly with the knowledge. So here, if you look at the domain and the problems with the use of knowledge in the domain, there is huge opportunities. And then we enter the domain of digital knowledge representation and dissemination. So what I mean by a knowledge artifact is that that's not the knowledge in itself, but it's usually, the artifacts can be on paper. It could be in an information system. In healthcare, we have something that is called clinical decision support. The rules that are used, they express knowledge. We have them in the description of an ordered sequence of healthcare events in a digital care pathway. And here I'm saying that a digital care pathway is a description of what we are supposed to do. We also have order sets, which is more like a checklist. Biomedical knowledge is expressed in documentation templates, is used to visualize large amounts of health data. That is critical for clinicians and patients to understand their situation and the situation of the patient, and then decide on what to be done and what are the relevant outcomes. Next, knowledge is expressed in the presentation of in the goals of the healthcare, the outcomes that are to be achieved. And then when we have a data set and want to assess the actual outcomes, the terms that we use in the queries in the database and to generate the report also is a knowledge artifact. And if you remember what I said, that knowledge has a life cycle, It is born, it is taken into use, applied, and it leads to outcomes. And then you have new and better knowledge coming in. We are beginning to talk about the life cycle of knowledge. So a little more about digital care pathways. The thing here is that care is about multidisciplinarity. I send my patient to a physiotherapist. I send my patient to the pharmacy. I send my patient to a GP. We have care that takes place across many institutions. We have care that the patient does herself. We have care which requires the use of drugs. We have care that requires people and very advanced skills. We have care that is assisted by medical devices. We have robotic care. I work in rheumatology. I can see patients that have had their disease for 30 years. That means we have longitudinal care. And I have care to patients where the problem is that there is no high quality knowledge and tool to apply on their problem. That is also the backdrop of digital care pathways. So what then is a digital care pathway? How are we to understand them? And this is not a definition, but it is a description, I think. I don't think a digital pathway can and should be defined, but I think of it as a planned sequence of goal-directed, of course, knowledge-based, of course, healthcare events to a particular group of patients. And the core thing here is that a healthcare organization or a group of collaborating organizations have agreed upon and committed themselves to realize in a safe and reliable and accountable manner. So when we talk about pathways, it has something to do with a commitment, a set of activities that shall lead to outcomes, and where the outcomes can be used to evaluate and continually improve on the digital care pathway. And then we enter the core, the defining function of a healthcare professional and organization of healthcare professionals in an institution. It is the process of thinking about something in order to make a decision. When we reason in healthcare, we do what sometimes is called abductive reasoning, which is defined as the making of inferences by updating beliefs leading to the best explanation. And here comes the importance of learning to be able to reason well. A person that has finished medical school, at least in Norway, he has spent 6 years in developing the required insight into the knowledge base and learn how to use it in practical problem solving. And what this person is trained on is actually to do reasoning. And now it has been like this for many 100 years. And as of now, we are beginning to see machines that can learn, reason, predict, and even act. I like to think of a hospital as a system that is dedicated to organizing and delivering a largely brain-based reasoning service. And this organization is also responsible for postgraduate training. The thing about physical hospitals is that service is constrained by geography and by availability of people that have the required training. Because of this huge technical achievements, we are, as a domain, irreversibly, I think, heading towards a virtualization. it has nowhere else to end, in my opinion. And I think the only questions worth posing, how are we to get there in a quick, secure, and safe manner? And how can we position ourselves as people with competence in these digitally transformed care environments? So then, what does this mean? What does it mean that we have lifelong machine learning, reasoning, and prediction? There are some important topics when we switch to a virtualized care environment. We have the question of identity and authenticity. How can we make sure that people, machines, knowledge, and services are for real and don't pretend to be something else? And this is a field that I have been quite active into the last 3 or 4 years. If you Google the Verify Med project, you can find the publications about that. A very important thing is to have machines learn from EHR data. How do we distinguish between the state of the patient and the care that was provided to influence on the state? By this I mean health record is more about the transaction, what was done by whom and when, and the record is for accountability and audit. A record entry for one patient doesn't clearly state what is the description of the state of the patient before and after care was delivered. Machine learning across health platforms, institutions, and jurisdictions. How do we enable distributed, safe, and accountable federated learning? Talked about safety in AI prediction services. I think we need to assess the outcomes of prediction services in general. How do we collect and make available the relevant outcome data so that both model vendor and care provider organization can account for the quality and continuous improvement of the services? I think that's one of the most important questions in AI today. Scaling the access to reasoning services. Which architectures and infrastructures are required to establish a reasoning service market where the services are rewarded according to the outcomes they produce? How do we reward quality in a virtualized healthcare environment? This is hugely important. So what are the good questions on digital care pathways? We heard about sustainability in the last talk. How can we make care pathways more resilient to resource constraints? Because this is a very obvious thing at this time of demographic change. Related to socio-technical systems, how do we achieve the largest synergies between people and machines? With respect to learning health systems, how do we enable a learning health system when both people and machines will have to learn? And finally, multidisciplinary and multi-institutional care. How do we enable people to learn from the outcome of their work when their contribution is one of very many others? What I'm saying here is that we need, in principle, lifelong learning of machines and of people. So then my last slide, what are the possible research and innovation agendas for continuous learning? Which tools, infrastructures, and services are needed to make health data eatable for learners and reasoners? For discovering new associations, which are needed to automate the discovery of new knowledge? On the topic of extending digital pathways to include and engage the patient. What characterizes a health data infrastructure that can represent the state of the patient irrespective of her location? And finally, representing know-how in digital care pathways. Which knowledge management and dissemination practices are associated with the securest and safest clinical practices in a virtual physical care environment? Thank you.
Thank you, Arild, for your excellent talk and all those questions that it was really nice to follow and also think at the same time. I really liked about your summary or description to see the hospital as a brain-based reasoning service center. And it's really the fact that one or more brains are trying to examine and investigate disabilities in other brain or joints or heart or kidneys, and try to make the best plan how to care and rehabilitation plans, etc. So I really like that point. How do you see the timeline as a clinician and a rheumatologist, that how near will be that kind of future that you really can integrate in practice these human brains and these AI, and also patients and caregivers are tightly involved in the pathway? All these partners together, this integration has been developed.
We have to put it on a proper agenda, I think. And as futurist in health informatics, I think I have been talking about this for maybe 10 years, and it hasn't yet happened during those 10 years. Some of these problems are of multidisciplinary nature. We need a multidisciplinary organization of the work and a multidisciplinary research and innovation agenda. But we also need a very clear focus. And that focus is, I think, healthcare will always be about people. Healthcare will always be about the safety of patients in the threat of damage and disease. And healthcare will have to be sustainable. If not, it will be a damage to the society that tries to fund it.
Yes, you are really right. And also one important aspect is really that we educate the staff, but also that we allocate time for them to really spend time with these digital pathways, as this is exemplified for the current status in our unit, that we have digitalized pathway for children and adults with the epilepsy. And these patients and their caregivers are using these digital pathways, but we have to allocate more time for our doctors and nurses just to really look at the digital pathway and the information what has been stored by the patients and their caregivers concerning numbers of seizures and the use of drugs, etc. So really find time to use really the pathway and take that into account in your brain-based decision making. That is also very important.